Hello everyone, welcome to QXon. In this video, we will see some very important cases regarding the respiratory system. Respiratory system diseases are broadly classified into obstructive lung diseases and restrictive lung diseases. Hence, we will see one example of obstructive lung disease, that is asthma, and another example of restrictive lung disease. Plus, we will also see that how hypoxemia occurs in high altitude sickness. Okay, with this, let us see our first case. A group of college students go on a hike to the eastern Himalayas, Sikkim. They decided to set camp there for 2 weeks. One of the students starts developing sudden onset of weakness, breathlessness, nausea, vomiting, palpitations within 8 hours of the time when they reached there. They rushed to the nearest hospital. On examination, it was found that the pulse rate was 102 beats per minute, blood pressure was 180 by 90 millimeter of mercury, oxygen saturation was 56%. Respiratory rate was 46 breaths per minute and chest X-ray and ABG were done. So with this case, we need to answer certain questions. First of all, what is the most probable diagnosis? Now, for diagnosis, first we have to see the key features of the case. So let us see what are the key features. See, obviously, the students have visited to a high altitude and they have decided to stay there for 2 weeks, but within 8 hours of reaching, there are certain symptoms, that is weakness, breathlessness, nausea, vomiting, palpitations. And on examination, what we find is there is tachycardia. The pulse rate is quite high. Whenever the pulse rate is more than 100 beats per minute, it is known as tachycardia. There is hypertension also. Blood pressure has increased. Oxygen saturation has become quite less. It is only 56%. Normally, the oxygen saturation in arterial blood is around 97%. And respiratory rate is also quite high, that is 46 breaths per minute. So, most probable diagnosis given the scenario here is acute mountain sickness. So, with this, let us see what are the respiratory changes, hematological changes, major complications associated with this condition, and what is the treatment of this condition. So yes, the diagnosis is acute mountain sickness. And what are the respiratory changes which occur in acute mountain sickness? Well, you see, whenever we climb to high altitude and don't take adequate precautions, that means the rate of ascent is very fast, or we climb to a very high altitude very fast. In that case, our body is not able to adapt to the changes in oxygen partial pressure in atmosphere which is occurring. So, because we are climbing to high altitude, because of the thinning of the atmosphere, there is decrease in total atmospheric pressure, and this also causes a decrease in the partial pressure of oxygen in atmosphere, right? So now our respiratory system starts responding to this, because when partial pressure of oxygen in atmosphere is less, we are inhaling less partial pressure of oxygen, and ultimately the partial pressure of oxygen in arterial blood also becomes less. So this is detected by peripheral chemoreceptors, which send the signal to the neural centers of respiration and cause increase in the rate and depth of respiration. Now, whenever there is increase in the rate and depth of respiration, there is carbon dioxide washout, because the ventilation is increasing, isn't it? So, carbon dioxide will be thrown out, and this will lead to respiratory alkalosis. So, pH is going to increase. Now, you might be aware that pH is also one factor which affects the respiration, right? So, here, even though hypoxia is causing increase in the rate and depth of respiration, if this pH increases, it is going to inhibit the increase in respiration, right? So instead, body compensates by excreting bicarbonate in urine. So there is excretion of alkaline urine, and hence this increase in pH is prevented, causing steady increase in ventilation. Now, the efficiency of ventilation is measured by something known as ventilatory equivalent, which is nothing but expired minute volume divided by oxygen consumption. So, it is a ratio of expired minute volume with oxygen consumption. So, these are the basic respiratory changes which occur in acute mountain sickness. Then, there are hematological changes also occurring, that due to hypoxemia, what will happen, that there is production of erythropoietin, and also this causes increase in RBC production. So, erythropoietin production will cause increase in RBC production. Then there is also increase in 2,3-DPG concentration. Now, these hematological changes take quite a time. So, here respiratory changes actually start occurring fast, but this steady increase in ventilation, which we are saying, occurs almost around the 4th day of landing on high altitude. So, excretion of alkaline urine is important for steady increase in ventilation. Similarly, these hematological changes also take some time. Then, the complications. See, ultimately hypoxia, what it does is it causes pulmonary vasoconstriction. The partial pressure of oxygen has a differential effect on the vessels of the pulmonary vasculature versus that of the systemic vasculature. In systemic vessels, it causes vasodilation. If there is deficiency of oxygen, there occurs vasodilation. While in pulmonary vessels, hypoxia causes pulmonary vasoconstriction and hence pulmonary hypertension. So, ultimately, it can lead to right heart failure. Then, it can also cause cerebral edema, what is known as acute cerebral edema. In this, what happens, that due to hypoxia, there is vasodilation of the cerebral vessels, and hypoxia also causes increase in permeability of the cerebral vessels, and there is leakage of fluid from the cerebral vessels to out. So, this leads to cerebral edema. So, what is the treatment of this condition? Well, it requires oxygen therapy, because as you know, the main cause of acute mountain sickness is decrease in partial pressure of oxygen in atmosphere. So, increasing the partial pressure of inhaled oxygen will cause the treatment of acute mountain sickness, because that is the primary problem. So, yes, it requires oxygen therapy, then it requires glucocorticoids, diuretics, because as we are telling that right heart failure may develop. Then it also requires a nifedipine, which actually reduces pulmonary arterial pressure, as we are saying that hypoxia causes pulmonary hypertension.